They're also quite skeptical about the vaccine. So I volunteered as tribute.
2020 was a tough year for everyone. No matter what your status in life or location in the world is, each of us felt the impact of COVID-19 in our lives. The loss of lives, the disappointment due to change in plans and loss of livelihood is indeed a pain that is still lingering inside us. Although this battle is not yet over, in this episode, we would like to celebrate humanity's wins and honor our heroes. So today, I have the privilege to talk with Christian and Josephine. Both our guests today have very unique experiences with COVID-19. We have Christian, who is a nurse in Germany, and Josephine, his fiancé, who has been a survivor of COVID-19. Hi, Christian and Josephine.
Hello.
Hi,
Good
hi,
morning from Berlin.
hi from Australia. Hello, Berlin. So first off, Christian, how is it being a nurse at the height of the pandemic?
I work in a big medical hospital in Germany. And actually, I am a nurse anesthetist. Like I work in the OR, like operation room normally. But now that they need like a lot of nurses for the COVID ICU intensive care, we are now in a rotation. Because I have like ICU experience, like on the first wave last year, I was already in one of the intensive care unit, but there was no COVID patient. It was like more of a training, like more of a reorientation, because it's different here. I also want to know how it is. And now at the height of the pandemic, it's like we are now like they created a big building, like 4 stations in one building, only for COVID ICU patients. And the ones working there are from different stations, from the OR, from ICU, and also doctors. There are doctors who are like working as assistants. And yeah, but it's really a great atmosphere. And I like working there, like, but of course you have to do the precautionary measures, like you have to do your like to wear all the stuff to defend yourself, to protect yourself from the virus. And then yeah, that's also one thing, because it's not only about protecting yourself but also protecting your family, your loved ones, because like I said, we're together. And then she's working in a kindergarten, so she's taking care of kids. So that's why it was also one of the trials, because on the first wave, like I said, in this IC unit, there was no COVID patients, and then it was not really, for me, it was not respectful the way they did it, because on one day they just told me, okay, starting tomorrow, we'll be going to the COVID ICU. I was like, what? Like, they did not ask me personally. And then I don't know how to take care of COVID patients because there were no COVID patients there. So I declined. It was not that easy like, to like say, okay, but it was also a difficult situation. But then I went back to war. Like in the second wave, they already told me, okay, they already asked me politely, and then, okay, I'm ready. I think it's also my turn now to really take care of these COVID patients. And then, yes, and then it was not, I started December. I was supposed to start November last year, but then I was in quarantine because my girlfriend, like Josephine, my fiancé, she got the virus at her work.
At work at the kindergarten?
Yeah, in the kindergarten.
Oh.
Yeah, actually, they're the infectious ones, the children.
Oh, really? Oh.
Yeah, yes, because one got positive, one parent was positive, and then there were like 6 of them in this group, like 6 workers, kindergartners, and then 5 of them got sick, like, and they have to close.
Oh.
Okay, and then she already got the virus. I was like, okay, I'm really, because for me, the thing was, what got me like busy in my mind, was like, I'm afraid to bring the virus in the house. You know what I mean? Like, I'm afraid because I will be bringing the virus. I know it's part of my work, but I also want to protect my loved ones. Like I don't want
Yeah.
to be like this because I have, for example, like we're talking about like if I should live in a hotel
Oh,
or like somewhere, and then she told me no, it's not necessary, and then we should like stay together and stuff, and then yes, and yeah, and then I started officially in December,
mm,
and once it's like there are like three levels of nurses there, like level 1, 2, and 3. Level 1 is like when you're only you're like working like a OR, like not, you're not a nurse but a OR staff, like you don't really know about nursing. It's different. Second, level 2 is like nurses without ICU experience, and the level 3 is like ICU nurses.
mm,
And my experience in ICU was in the Philippines. It's quite different. So they wanted to give me like, because the ratio is 1:4, one nurse to four patients,
mm,
like ICU patients. It's not really like that easy, like to have to take care of four patients at once
mm.
without knowing what you should do. Like I said, I was not able to take care of COVID patients before. So I told them, like, before I got transferred, I got rotated. I told them I wanted to be reoriented. Like I want to have an orientation of what they do and stuff. And so that's what they gave me. And then yeah, after like I think 3 weeks from, I was like between level 2 and level 3. After 2 weeks, like they told me, okay, they asked me, are you ready to be like doing all that alone level to go to level 3, level higher? I was like, okay, yes, I'm ready to do that because I already got some idea on what to do, and then I should know because I'm taking care of lives. Yeah, if you don't
Yeah.
know anything, if you don't know what
Mm,
you're doing, like what are you doing? Like you're just risking people's lives.
yeah, exactly.
That's
Correct.
why I was really, I wanted to learn as well. Yeah, a really important part of the job to know what you are doing.
Yes, exactly. And you know, all of us civilians, all of us non medical people know how much training it needs to be in your profession. And nonetheless, this pandemic has really highlighted the the importance of the work that you do. So, aside from the orientation that you did at work, what other preparations personally did you do?
Oh yeah, because before I started that, already have like I work out, I jog, and then I also have to prepare myself not only physically but also emotionally, and yeah, I like mentally as well. And part of it is for me. I was luckily I already started like a program because I wanted to like maintain the healthy lifestyle. So I jog like almost like 3 times a week and stuff, and also to work out. It was really important for me, and then as well as doing a diet, like making healthy food and getting enough sleep.
Yeah. Do you get enough sleep though if you're a nurse?
Was getting enough sleep is sometimes one problem for me because because sometimes I stay up late at night or I cannot sleep or something. But when I started doing sports, it was better for me because I was really tired, and then okay, and sleep. I was able to sleep like longer, and like yeah, I wake up like okay, more livelier, like livelier before. Yeah.
Mm. And also going back to Josephine's experience about her getting the virus. So what were the symptoms initially that you felt, Josephine?
I had this cough, the special dry COVID cough, and then I started cough. I think like on Friday when I was finishing work, we got a call that the father of one of our children got tested positive. So we were a bit like, I don't know what's going to happen. And then on Saturday, I already started coughing, and Christian was like, why are you coughing all of a sudden? After the message, and I was like, it's just the heat because the air is so dry inside. So probably that's why I'm coughing. But then it got worse quite quickly. So on a Sunday, I already felt like pain in my limbs, I started having this cold shivers, but then all of a sudden I was really hot. Then I already had fever, and I had a lot of symptoms directly in the beginning. And then I just felt really bad, exhausted and tired. And then I think I slept through for 1 week.
So, Christian, when she caught the virus at that time, you weren't yet, you weren't able to have that orientation yet?
No, I was not. I was not yet assigned, and I was supposed to start, I think, a day like before we got the message that she had COVID. And because I told her, okay, you should because she told me about the story about the dad who was positive. I was like, okay, you should be tested. So we got the test, like the results.
I think you were supposed to start on Wednesday.
I was supposed to start on Wednesday, and then we got the results on Tuesday. And then there's the rule that you should be in quarantine. So I told them, okay, you should be in quarantine, so I will not be able to work. The rule here is like starting, it's only 10 days, I think, like starting like the symptoms, they counted like the start of the symptoms, then 10 days after that. But if you still have the symptoms, then you have to extend like 2 days. It was the doctor who told her about the results, but then they will be contacted by the, what call this? It's like the health relations officer or something like that, like in the city, like in the
health office,
in the health office or something. It's not cities, more of like the neighborhood. So she got contacted and then told her, okay, you should stay at home for a couple of days, like 10 days exactly. And for me, because I didn't have any symptoms, I think they told me maybe I should stay longer at home. I should be quarantined longer because could be that I will be developing symptoms after some time. And then they will count the days afterwards, like, okay, you should be like still in quarantine after 10 days.
Yeah, it's a quite complicated system. So when you're infected and you have symptoms, they count the days from the beginning of your symptoms, because then they can know when approximately you were incubated and how long you can affect other people as well. And then when you have longer symptoms, you have to add 2 days to your quarantine. But when you only had contact to a person but no symptoms, then you have to stay 10 days from the last day of contact with the person, with the positive person.
But then she had like mild symptoms, but then they were like, I think they were typical symptoms from COVID, from what we read about. Like, and one thing, she was not really able to taste and smell. Except like for tasting, she can taste like spicy food.
I can reckon. I can feel it.
She can feel it. She can feel spicy food.
You can just feel, but you cannot really taste.
But other stuff, she was not. And she was really like, and to add to that, she was about to take an exam, her final exams, because it's her last year of school. And she's like, oh my God, so you have to calculate, okay, how many days should I stay at home? Because I need to take this exam. It's really important because it's her final exam. She doesn't want to postpone it because she wants to get her diploma on time as well. So it was really quite a challenging situation for us, like, because, okay, because I was like, maybe like if you don't have that and I have this, then we should like also like quarantine ourselves from each other, like in-house. We should like, and then we did that as well. Like she was sleeping in the, I was sleeping in the living room and she was sleeping on her bed. So we did that.
In your bed. Did you wear mask inside the house, Christian and Josephine?
Yeah.
Oh.
Yeah, we were, and then when we wanted to watch something, like we sat on the couch, but it was a distance as well, like 1 meter,
and we had masks,
1.5 meters, and we had masks.
Oh.
Because I don't want to, I want her like to take the exam. I don't want that she will be postponing it because she got reinfected by the virus. So that's why I was also careful. I was thinking, okay, this is okay, we should do this, and then that's why. And then she got a good grade. by the way at all.
Congratulations, by the way.
Yeah, the problem was that in Germany, they run really short on tests. So they did a lot of testing, but then the labs couldn't conquer all the tests and put out all the results. So they kind of stopped giving out tests to everyone. So only when you had COVID symptoms and you went to get tested, then the test was for free. And otherwise you had to pay 90 euros, even when you had contact with a positive person, and even in our case, direct contact. So he would have had to pay 90 euros for the test.
No, not really. I don't have to pay because I'm
at work, but like in this case.
Yeah, if I was not working in a hospital, I should pay. But now I'm working in a hospital, and then in this COVID ICU, we are like we have weekly tests, like COVID tests, like we have the nasal swabs. Yes, weekly.
Weekly COVID test, the one in the nose, the one that I feel like your nose will be very much haggard in it. But anyway, it's quite necessary.
Yeah, nose and the throat. Yeah, the swab test. We do that weekly. And then we also have like the package, like the test kits, which you can bring at home, the antigen test.
Okay.
And then yes, we have that at work. So for me, I'm quite confident because I'm like protected, and I also get tested.
Yes.
And right now I had the vaccine, so yeah.
I saw you. I think that was your second dose that I saw in Facebook, and I was very, very interested to know. And of course, our listeners also would like to know your vaccination journey and what kind of vaccine you got in Germany and all those preparation or any side effects.
The vaccines in Germany, we got that from Pfizer and BioNTech. BioNTech is a company in Germany. They're also one of the companies who got the vaccine first. Like they developed the vaccine.
And I think he's an immigrant as well.
Yeah, I think he's Turkish. So going back to the vaccine, I got my first dose on the first day of the new year. So January 1st, 2021. But then I already got some idea about the vaccine because I was also skeptical because it was not really proven. It was really fresh. But then it told us like 95% effectivity and stuff. And I got the opportunity because I was already like working in this COVID ICU. And then I was like, okay, because I will not only want to protect myself, I'm facing like COVID positive patients every time. And then I also want to protect my family. So, okay, I'm going to do this. And then there are also a lot of friends, like family and friends. They're also quite skeptical about the vaccine. So I volunteered as tribute.
She was super skeptical, and because of her age, she was eligible to get the vaccine now in January. But she told me at first she didn't want to get it. But then Christian got his vaccine, and he had reacted really well and told her all about it and kept her updated. And
okay.
She decided to get it.
So going back to the vaccine, the BioNTech and Pfizer vaccine has like 95% effectivity, and it is made of mRNA, and there's no eggs.
So can you expound a little bit more on mRNA for me and for our listeners?
It's like a part of the virus, because vaccines, they work like this. They will instill a tiny portion of the virus so that your body will get to know the virus.
Right.
And then they'll develop, okay, how can I cope up with this virus? Because actually the people, these symptoms, what we experience, that's the reaction of our body, of our immune system. So if your body already knows this type of virus, they will not overreact.
So, what were some of your preparations before you undergone the vaccination process?
Like I said, I also did research before I got myself vaccinated. One thing to prepare is like you're not allowed to drink alcohol, like before and a couple days after. And I also did not do sports as well. Actually, before you can do that, but for myself, like I did not do sport because maybe I will, for example, if you do workout and the next day you get vaccinated and then you have muscle pains, you will not know if it's from the workout or if it's from the vaccine.
Yeah, totally agree. So, it was good thinking.
So that's why I did not do it. So I want to really differentiate the symptoms. So I can really distinguish. Like I can really say, okay, it's from the vaccine, it's not from the workout. So that's why I intended not to do the workout. I did not drink alcohol.
Yes.
And then yeah, so I got the vaccine on the first day of January. That was in 10 in the morning. I still have to work. I had a day shift. One experience I only had like soreness on my affected side that was injected on my right arm. So it was kind of numb and sore, but then after a day, it was quite okay. And I was able to do sports again in 2 days. Uh, so it was, I did not really have bad side effects. By the way, I have like allergies.
Oh, right. So, for those people who have allergies, from your experience, what should they avoid or should they avoid this? I guess they need to ask their doctors.
Oh yeah, you still have to consult your doctor. Now, like, okay, actually, this vaccine it should be given to 16 years old and above, not really to younger ones. And then, although it does not include like eggs or like seafood in it's only like mRNA part of the. If it is like possible that you can take this vaccine, and then on the day when I took the vaccine, there's also a waiting area. Like you have to stay there for 15 minutes for monitoring. If you have any side effects, then they will be there. You know what I mean? Like if you have within the time limit that you're giving, I think within 45 minutes, if you have really like fast allergic reaction to the vaccine, I think you will not be allowed to take the second dose.
Oh, and for the second dose, how long is the gap until you take the next one?
Dose 21 days after the first dose. I think 21 days to 48 days after. I got that on the 22nd of January. So it was exactly almost 21 days after. So I got the vaccine. It was 8 in the morning. It was fine. Like I was like, it's normal if you get a vaccine. So the next day it was the same after 24 hours. But after a couple of hours, like I think 35 hours, also posted it on my Facebook. Like I felt like I was having the flu-like symptoms, like runny nose, and then I think I will be having fever and stuff. And then I was really tired. I was really like the fatigue was there.
Since you experienced some fatigue, did you have to take some medication to lessen the symptoms?
Like some people already took paracetamol before to lessen the symptoms. I decided not to take the paracetamol so that I will know like the height. Like assigning myself to be the laboratory rat.
Yeah, you're the guinea pig.
my loved one. So decided, okay, I'll just sleep and then tomorrow it'll be fine and stuff. And then yeah, the next day I was feeling much better. I was still like really tired, but it was better like than the night before. And I did not have fever.
Ah, okay.
Because I know someone who got to her first dose. She got chills and fever. But that's also actually if you got those symptoms like on the first dose, it's usually that you had the virus before, like you already had the virus.
Oh.
Yeah. Like it was a statement from a friend of mine. I don't know if it's accurate, but it is like they said, like if you got the first vaccine, the dose, and then you got the symptoms, it's most probably that you had the virus before. So far now I'm doing good. I'm on my vacation leave, so I can really relax and at home because we're not able to go outside that much because we're in lockdown.
Oh,
So
really? Currently, right now?
yeah, we're in lockdown. Yeah,
Oh,
until the middle
okay.
of February. February, like on Valentine's Day. Yeah.
Oh, and then everyone will go out.
Yeah, actually we can, but the restaurants are closed. Yeah, we can still go out, but if you go buy food, they're only for takeout. And the malls are really closed and stuff. Yeah.
It's just like essential things that you need to do.
Yeah. But it's not
Oh,
really compared to other countries. I think it's not that strict. It's not like in the Philippines that they're really, really strict that you need a pass,
yeah.
like you need to show these documents to be able to go out. No,
Yeah.
it's different here because if you do that, what they did in the Philippines or what they're doing in the Philippines, like people here are gonna rebel because they will say it's like dictatorship.
So in Germany now, what is the priority in terms of receiving the vaccination?
Prioritization, they prioritize first, like the ones like on the first line are the older people living in like homes for aged.
Yeah, the elderly people.
Then in the front line, like the ones taking care, like directly taking care of the ICU patient, like COVID patient. A couple percent of the population in Germany who still got the vaccine. It's not. I think it's lesser than 10%.
Oh,
So, and then actually there's a website where you can calculate or you can you will be able to know when you are able to get your first dose and your second dose according to this scheme. If you're working like in this type of job, then you're not really a priority. They prioritize like people who are like, for example, like cancer patients or really at risk. They are like one of the priorities of the vaccines.
so for Josephine, since she's dealing with kids, the people in her profession, are they considered a priority in this vaccine?
Not really, actually. Yeah, we kind of feel very forgotten right now in the debate because in the media or officially they tell people that kindergartens or daycare centers are shut down, but we're actually not. So we have half of the children there in daycare right now. So we're still quite open. And down in Germany, they made different groups who get the vaccines first. And I know it's important and we don't have enough vaccines right now, but they put people working in daycare over small children right at the end of those groups that get the vaccines first. But now the recent numbers have shown that we have the most infections, even more than people working with elders. So we had many more risks that were completely forgotten or crossed out by the politics right now. So yeah, we're not in the best situation, but yeah, we have to deal with it. We have no option.
Yeah, that's also one thing I don't understand because 5 out of 6 were infected by the virus. And actually, the children, the kids, are the most infectious ones. They're really young, but they're really infectious. And then, despite of this, they were not tested. Like there was the government didn't have the initiative like to send some people to test. They have to go to their own doctors to get the test. I'm actually quite disappointed. They should belong to the priority because they're taking care of children. Yeah.
And we all had symptoms as well. And of course, compared to people in the ICU, we had mild symptoms, but one colleague of mine isn't able to work since November because she had such bad side effects from COVID and her heart. I don't know, there's something wrong with her heart now, and that wasn't wrong before COVID. So we can actually say it's from having the COVID infection, and now she isn't able to work. So when more and more kindergartners have COVID and have bad side effects of the disease and can't work because of that, because it's an exhausting job as well, then we have a lack of kindergartners in the end. And I think they don't realize that right now because they're like, oh, they're still quite young, so it can't be that bad. They don't have the places in the ICU, so we put them at the end, but they don't realize we have symptoms as well. And I still have side effects from my COVID infection. So I still have problems with breathing and I still have like some chest pains, when I breathe. So I think they often forget that.
Oh, that's very concerning to hear that. And it kind of hit differently when somebody I know or somebody I'm talking to have experienced COVID compared to just hearing it on the news. And it's good that you've shared this concern through this platform so that at least some people would know that people in your profession also would need to be included in the narrative in terms of the prioritization of the vaccine. And you mentioned about some lingering symptoms. How are you managing it right now?
So I waited a bit, but then the breathing issues wouldn't go away. So I went to my doctor, but he just basically told me there are so many people right now that have side effects and breathing difficulties after COVID. And there's no medication for it. You just have to wait until your lungs kind of heal from it. So there's nothing we could do. I shouldn't do sports. I should rest more. And that's all he can say. So I asked him if I could do jogging again or something, but he was like, oh, yeah, maybe for like 5 minutes in a slow tempo.
I'm just jogging in a slow tempo.
But he told me there's nothing he can do for me right now, so I just have to wait.
Thank you, Christian and Josephine, for sharing your experiences with me and with our listeners. Indeed, it was very insightful and we've learned a lot. It's quite different hearing it personally or I'd say virtually. And I hope that you will be continuing your full recovery from COVID-19.
Yeah, thank you. Dankeschön.
Dankeschön. Yeah, Dankeschön. Now, Christian have shared to us his experience taking the vaccine in Germany. So how will it be in Australia? Australia has entered into 4 separate agreements for the supply of COVID-19 vaccines, and once they are found to be effective. So you could head on to the Australian government website for the daily updates, which is www.australia.gov.au. And the information is changing daily, so as of this recording, the only vaccine approved is Pfizer BioNTech vaccine, which was Christian's vaccine as well back in Germany. And it will be expected to be available to phase 1A patients in mid to late February in hospitals. So once the AstraZeneca vaccine is made available after a successful phase 3 testing, this will be administered to phase 1B patients in March 2021. So the Australian government will roll out 5 phases, giving priority to those in higher risk groups. So as I mentioned, it was phase 1A. These are the frontline healthcare workers, aged care and disability care residents, quarantine and border workers. And phase 1B, which will be the recipient of the AstraZeneca vaccine, are the elderly adults aged 70 years and over, other healthcare workers, Aboriginal and Torres Strait Islander people over 55, younger adults with underlying medical conditions, including those with a disability, critical and high-risk workers, including defense, police, fire emergency services, and meat processing. Phase 2A are adults aged 50 to 69, Aboriginal and Torres Strait Islander people 18 to 54, and other critical high-risk workers. Phase 2B is the rest of the adult population, which is me, and a catch-up of any other Australian unvaccinated from the previous phases. And phase 3 would be the under 18s if recommended. Now, due to the unique storage temperature requirements of the Pfizer BioNTech vaccine, which is minus 70 degrees Celsius, and considering that Australia is very far away from Germany or wherever this will be originally formulated, it will only be primarily available in hospitals that can accurately store the vaccine in the phase 1 of the national rollout. But for the AstraZeneca vaccine, which is for the phase 1B recipients. This is developed by the University of Oxford and can be made locally in Melbourne. And then this is manufactured by biotechnology company CSL. Australia has secured 53.8 million doses of this vaccine. 3.8 million doses will be delivered to Australia in early 2021, and 50 million will be manufactured in Australia in monthly batches. CSL will manufacture these doses on behalf of AstraZeneca. For more updated information, please visit tga.gov.au and australia.gov.au. So I hope our Zesties and Zestmates enjoyed this episode and learned at the same time from the experiences of Christian and Josephine. Stay tuned for the next episode as we get a bit more up close and personal with them.